This is Ricardo Sanchez. Looks like it's 3 o'clock. Is Ryan Brooks and Sung Oh on?
Mr. Brooks has just joined us. I'm promoting him now.
Oh, excellent.
Member Brooks, if you could please do a quick mic check.
I am here. Thank you much.
Thank you, Ryan.
Ricardo, this is Anne. It's my understanding from Debbie that I do not believe Sung is available for this meeting.
Okay. Well, then we'll just proceed then. I think we'll have enough for a quorum here. You guys ready? All right.
This meeting is being recorded.
Mr. Chair.
Excuse me?
I said we're ready, Mr. Chair.
Okay, thank you, Ryan. Good afternoon. Welcome to the January 27th, 2001 meeting of the Communication and Public Education Committee. I'm Ricardo Sanchez, the committee chairperson. This meeting is being conducted consistent with Governor Gavin Newsom's Executive Order N2920. People watching the webcast can only observe the meeting. Anyone interested in participating must join the WebEx meeting. Instructions are posted on our website. All lines are currently on mute. With the exception of our council, lines will remain on mute until I direct staff to open them for public comments. I will announce when we are accepting public comments. I have advised staff to allot 2 minutes to each person providing comments. This approach is necessary to facilitate this meeting and ensure the committee can complete its business. I appreciate your understanding and patience. I will now ask staff moderating the meeting to provide general instructions to the public.
Thank you. This is the moderator. We will be utilizing the question and answer feature in WebEx for processing of public comments today. When the chairperson calls for public comment, we will open the Q&A panel. You will locate the Q&A icon on the screen. Click on that, type "I would like to make a comment" into the ask field and submit that to all panelists. We will be taking public comments in the order that they are received. Serial comments are not accepted. Again, you will have a 2-minute time limit and I will give you a 10-second reminder. When I open your line, I will let you know that it is open, and at the end of your 2 minutes, I will mute your microphone again and move on to the next public commenter. Thank you.
Thank you. We will now move to agenda item A. I call this meeting to order and will now take roll to establish a quorum. Members, as I call your name, please remember to open your line before speaking. Ryan Brooks.
I'm here, Mr. Chair.
Okay. Shirley Kim. Shirley Kim. Okay. Thank you, Shirley. Jason Weiss.
Good afternoon.
Good afternoon, Jason. Okay, it looks like we have a quorum. Thank you. We have a quorum. Let's move on to item B. The committee will now hear public comment on matters that are not on the agenda. The committee cannot discuss or take action on any matter raised during this part of the meeting except to place the matter on a future agenda. Is there any public comment on items not on the agenda?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the ask field. Submit that to panelists. We are displaying instructions on the screen for your reference, and we will pause for a moment. Seeing no requests for comment, would you like me to close the Q&A panel?
Yes, please.
It is closed.
Okay, thank you. Any board member comments? Okay, hearing none. Thank you. Let's move on to item C. Discussion and consideration of possible changes to the notice to consumers poster / display. No background on it. Business and Professions Code, Section 4122, requires pharmacies to prominently post a notice provided by the board to inform consumers about the availability of prescription price information, the possibility of selecting generic drugs, the type of services provided by pharmacies, and a statement describing patients' rights pursuant to Business and Profession Code Section 733, which prohibits its licensee from obstructing a patient from obtaining a legally prescribed drug or device except in specific circumstances. California Code Section of Regulations, CCR Title 16, Section 1707.6, requires pharmacies to post a notice to consumers, poster or video screen that is conspicuous and readable by consumers. Section 1707.6, subsection B, specifies the wording of the notice. Any changes to the current wording would require rulemaking to amend Section 1707.6 and possible legislation to amend Business and Professions Code sections. Copies of the text of VPC sections 4122 and 733 and CCR section 1707.6 are in attachment number 2 for the board members. The board provides English and Spanish versions of the poster that are 18 by 24 inches in size, and versions in Chinese, Korean, Russian, Tagalog, and Vietnamese that are 11 by 14 inches. A copy of the English version is in attachment number 2 also. The committee has asked staff to recommend ways to refresh the notice poster at the January 2020 meeting. The committee directed staff to seek input from consumer groups on possible changes to the wording of the notice. At this point, I'm going to have Bob Davila, our Public Information Officer, who is the liaison between us and staff, is done, and I'm going to have him elaborate a little bit more on that. So Bob, if you can get on and sort of comment on that, I'd appreciate it.
Thank you, Chairperson Sanchez. I wanted to go over some of the suggestions we've received regarding the notice for the notice wording and design. At the direction of the staff of the committee, we reached out to several groups that were involved in forming the original poster, the current poster, and we received feedback from 3, the California Alliance of Retired Americans, also known as CARA, the California Pan-Ethnic Health Network, CPAN, and Health Access California. In addition, we reached out to board inspectors who visit pharmacies, as you know, and have to observe consumer interactions in the pharmacy. Between those 2 groups, we received about more than almost 24 specific suggestions for the wording and design of the notice to consumers poster should the committee and the board decide to redo it. Those suggestions are listed in the report, and I won't go over all of them, but I do want to mention some of the ones that stood out because they were either recommended by both groups or they were touched on issues that board and current and committee members have raised in previous meetings. Under the suggestions from the consumer groups, they suggested the poster should have larger type and should be readable from a distance of 15 to 20 feet. They said that the design should be updated with modern design standards. It should have more photos and illustrations to draw viewers' attention. The consumer groups also suggested that, number 1, make sure people are aware that they can ask for interpretive services, and number 2, that interpretive services must be provided at no cost to the consumer. They suggested that the poster have very strong language informing consumers that if you have a complaint, contact the Board of Pharmacy, and that the poster provide the board's contact information for consumers to see. And they also cautioned, do not make the notice to consumers poster a catch-all for everything. There's too much information to include in the poster. Among the inspectors, we received almost a similar number of suggestions, and some of the key ones from inspectors were that they felt that the consumers no longer need to request a 12-point font, that no longer has to be on the poster because it's already part of law. That's something that the board may decide they don't no longer want to have on the poster. They also suggested, as the consumer groups did, that the poster should emphasize the availability of interpreter services. They suggested specifics to make sure consumers can help avoid medication errors by, for example, telling consumers on the poster to check the label to verify the patient's name and the medication name and strength before they leave the pharmacy. They suggested telling consumers to check the pills inside the bottle to make sure they match the physical description of the medication that's printed on the label. And they suggested, as this has come up in board meetings as well, that consumers be told that they can ask their prescriber to put the purpose for the medication on the prescription label. Another thing among inspectors is they all suggested that the consultation requirement is very important for consumers to be aware of, and it should stay on the poster. In fact, they said that this should be a priority and it should be printed in large type. And that consumers should be advised that there are other instances where the pharmacist must speak with the consumer, not just when getting a new medication. Finally, they also suggested to perhaps add information about corresponding responsibility or add information on where consumers can get more information from the board's website. The last thing that we heard from staff, from consumer groups and from inspectors is that the good design is critical to creating a poster that conveys information that is easy to read and understand. Most publications use clean, simple visual elements such as photos, icons, or other graphics to illustrate text. In the meeting materials, we included examples of DCA publications that use some of these visual elements effectively. Those are in attachment 2.
Okay, thank you. Staff recommendations. The notice to consumers provides important information on the public about their rights and what to ask a pharmacist about their medications. However, the dense wording of the poster overloads consumers with too much information to process and understand. In addition, the text leaves less space for visual elements that convey information effectively. Staff recommends the committee consider focusing on what are the most important things a consumer should know when visiting the pharmacy. The suggestions provided by the consumer advocates and board inspectors are useful as a starting point. It is worth noting that both groups have suggested pharmacist consultation and the right to interpretive services are important messages for pharmacy consumers. Staff welcomes any suggestions and direction on possible wording or other matters regarding the notice to consumers poster. Any board member comments or questions? Okay, hearing none. Any public comments?
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. We will now pause for a brief moment to allow submission. And our first request for comment comes from Stephen Gray.
Okay.
Stephen, your line is open. You will have 2 minutes.
Thank you very much for the opportunity to comment. I believe the posters are very important. However, when I visit pharmacies, I don't see the poster readily. The posters are off on the side. They're hidden below waist level, sometimes on the front of the counter. There's a real problem with the poster. And I was wondering, and I'm not asking a question now, but I'm wondering, we put provision in the law so that this poster could be put on video screens and provide information that way. And I'm wondering if the committee has asked the inspectors for information about examples of where pharmacies have actually used the video screens, as we had hoped they would, to get this information out. The second thing I want to comment on is I believe that the issue of putting the purpose on the medication label is very, very important. It was so important that the law required that the purpose be one of the 4 things that are in the 50% of the label reserved for those 4 things and had to be in 12-point font. So I think there needs to, and what we find is the consumers don't know that they can ask their prescriber to put it on the prescription so it can be put on the label. The bullet says, ask the prescriber for the purpose for the medication on the prescription label. And I think I know what you mean there, but they've got to know to ask the prescriber to put it on the prescription or with the electronic prescription in order to get it on the label required. Pharmacists can put it on the label, but they're required to do it if the prescriber made it part of the prescription. And I think there needs to be new emphasis on that. I find that very few consumers know that right, and it's still very important, has been confirmed by national organizations like USP, the Institute for Medication Safety, and Northwestern University. So realizing that as something most consumers don't know they have the right to have. Also, lastly,
10 seconds.
thank you. There is less and less consultation going on because of curbside pickup, deliveries, and mails, and that needs to be resolved also. Thank you.
Good points. Thank you.
The Q&A panel has been closed.
Thank you. Let's move on to item D. Discussion.
Chairman Sanchez, are we going to have a motion, or does the committee want to take any action on this, either to send it back to the staff to redraft, and if so, concentrating on which points?
Are you talking about the comments that Steve Gray mentioned right now?
Well, yeah, for the poster display. Is there any action being taken by the committee at this point?
Well, I had opened it up for comment, and I didn't get any feedback from it.
Chairperson Sanchez, I have some questions. This is
Okay.
Jason.
Okay, Jason, go ahead.
I don't know if this is a question for Anne, but where do we go from here? I was waiting after public comment. From our samples, I do like the very last sample that DCA has on their poster. That 6 points is very concise, has good visuals, has a headline so people can move from there. I just don't know, where are we in the process, and where do we go from here? I think obviously interpretive services is important. The issue of having the reason for prescribing on medication, making sure that people know that sounds to be important. Several staff has told us that, inspectors have told us that, Mr. Gray just reported on that. I think that's important. But really, where are we in the process? Do we need to narrow down what should be included on the poster from here? Is this something that staff should look at? If you could speak to that, please.
Absolutely. Yeah. I think we've provided some information to the committee for the committee then to give us feedback. If it's the committee's preference that staff take a first go at it and bring back, a draft of what it could look like, we're happy to do that. We can pull based on some of the common themes and go from there and see if you like whether or not we're hitting the target. I think part of the reason we provided, some of the feedback was, is the committee interested in prioritizing what maybe those 4 or 5 or 6 bullet points are. With respect to the design of the poster itself, we'll work with graphic artists and things like that. But trying to get kind of the messaging that you want to really, focus on when we redo the poster would be super helpful.
Hey, Mr. Chairman, this is Ryan Brooks.
Yes, go ahead, Ryan.
And so thanks for that explanation. I was part of the committee almost 8 to 10 years ago that actually developed this poster. One of the challenges with these posters, there's way too much information. And so the more information we put, the less people will read, the smaller the font gets. One thing that Steve Gray had mentioned is, where they're posted in the pharmacy. Well, every pharmacy is configured differently, which means there's no one spot in each pharmacy that we could poster be displayed in. And so I just urge the members of the committee, when you're looking at adding information, if it's too much information on the poster, no one's going to read it, and there's way too much information on it now. And I know that the statute requires us to have certain information on the poster. So I just hope the committee would keep that in mind as they move forward.
Yeah, that's good points. And I'd just like to point out that board member Brooks here is actually an expert when it comes to these billboards and give the information out. And he's been generous enough to donate some billboards to the state. And your points are well taken. And I appreciate that. I do think we have to narrow it down to what's going to get our message across best, Ryan. What is out of all? There's obviously a lot of suggestions that we need to we could put on there, but not to over put information on this document. What does the board members suggest? I want to hear a little bit from each one of you. Of everything we've gone over, what's the most important item you think should be on there?
Well, before we move forward with that question, I think maybe
Sure.
we could hear Anne just to
Sure.
see what information is required by statute before we continue to, 'cause some stuff we can't remove off. And I think we're going to need to take something off to create more space to add something new.
We might be limited then.
Yeah, so let's
Or,
get a bit.
yeah, it could be, or it's, do we still need that and pursue a statutory change if we don't think that it's required anymore? So it's the pricing piece is in the statute, and then the regulation itself provides the exact language, and so some of the other elements. So I believe that wherever we go with this, if the committee determines that changes are appropriate, that it's going to require changes in the law, and it's whether it is statutory as well as regulatory will kind of drive it. So we can, pursue changes as necessary based on the policy of the board. So in the meeting materials, I think that you have Business and Professions Code 4122. So in there, it lays out the statutory requirements. So if we wanted to change anything there, right, it would be a legislative change. If we feel like the information in 4122 is still appropriate, then I would recommend that we leave the statute as it is and really just focus on the regulation itself. And I do think that at minimum we can gain some space if people are agreeable, because the label now has to have the 12-point font. At the time that the poster was originally written, if the labeling, the font size was not mandated to be at 12 point. So that is at least one area that I feel like we could probably, maybe take that and leverage. But I think we will, at the staff level, we can either come back with some recommendations for you based on the feedback that we've received and show you maybe what the regulation language could look like, as well as some potential designs. But it's always helpful to hear, some feedback on where you think, you would like it to go. So we maybe give you something a little more ready for your review.
I think besides the what's required, I like the purpose of the for the medication. There's a lot of good, solid information that I would love to see on it, but again, we can only put so much. So let's. Any other comments from board members?
Hi, Ricardo. This is Jason. I think we did hear that interpretive services are important. Now, on maybe if you could speak to this, Anne, on the required information, it doesn't have to be the same size as the essential meat of the poster, right? We can have that be towards the bottom in a smaller font kind of layout if it's outdated or unnecessary and we don't need to pursue statutory changes.
Sorry, Jason, I'm not quite sure that I totally understood your question. Yes, we can absolutely play with the design of the poster and, yes, place emphasis on certain things, visually, either through font size or other design choices.
Okay. And Ryan, since you've been through this already, what were key important things that were emphasized to you be included?
Well, and part of the challenge, and this is a good question, and thanks for asking it. Part of the challenge is there was so much information that was required. The things that I thought were important, there was no space for it.
Yeah.
Look at these types of projects. If we're going to put information up, I always ask myself, what problem are we trying to solve? Right? Yes, I mean, if it's interpretive services, I think that's a good one to have because people can walk in and hopefully see that they can have the information said in different languages. 12 point, versus 24 point, yeah, maybe that's important. But, the challenge more comes with you have a poster and there's so much information on it, no one at all, and it loses its whole intent and purpose.
Yeah, and that's something that I picked up on your advice last time when we did the billboard, Ryan, was we have to capture the audience attention and get our message across, and we don't want to dilute it. So
yeah, and then Steve Gray did have an interesting comment. He did say we allow for video display, and that allows, which is great. I mean, if the pharmacy wants to install that and bear that cost. The good news about that is you could have 3 to 4 words per slide. And as you're waiting for your prescription to get filled, it runs in a loop. Way more effective than having a poster with 25 bullet items that you're not going to read and you can't see because it's behind the counter and you're in the waiting room.
Yeah, waist level on the side and so forth. Yeah, Stephen Gray did some good points out there.
Yeah, so I just caution, as we move forward with this, be careful what we wish for, and only include that information where you're trying to solve a problem, not I would like that to be on there. My points, my 2 cents today.
Yeah, well, those are good points. I just think we have to give staff something realistic to work with, and not we want all this in there and make it look good and get the message across. I'd love to hear some recommendations from the staff though, if they could help out on that. Go ahead, Ann.
Ricardo, this is Ann. So here's what maybe something that I would suggest is what if we take the notice to consumers poster and we focus it on important items that can reduce medication errors, right? So
yes.
For that, we would be reiterating the importance of consultation. I believe we would be reiterating the importance of interpretive services, right, if there's language is a barrier, and then maybe pick 1 or 2 of the other items that really get to, make sure that you know what the medication is and what it's for.
Yes.
And if we really looked at the notes, so if you're not interested in pursuing a statutory change, we will need to keep some of the provisions in from 4122, but we don't need to make that prominent, right? And maybe we can come up with 4 or 5 things focused maybe on medication errors that I do think would really benefit consumers, right? If we could reduce medication errors, that would be awesome. So if we focus this and really frame it all about our end goal is to reduce medication errors and get at it that way and bring you back something that maybe kind of speaks to that for your review at the next meeting, would that feel like that might be something that the committee might be agreeable with or feel comfortable with?
Sounds great. Otherwise, we're going to just keep throwing things out. There's a lot of good information that could be put on the poster, but again, we have to narrow that down. I'll open that up for the rest of the board members. Any more comments or suggestions? I'd like Ann's idea.
Hi, this is Jason. When we receive that new mock-up, could we please get a copy of what the current poster looks like, and then for reference in comparison to any potential new one?
Yeah, a copy of the current poster, and then also obviously an attachment or a copy for a future meeting of what the staff will be bringing back to us as a suggestion, right?
Yeah, so
Yeah.
attachment two has our current poster, and then it also has samples of other ones that might be, are probably a little bit more effective in communicating things, but we can absolutely give you a side-by-side comparison. Any changes that we do make, right, are going to require regulation depending on the scope of the changes. So we'll try to come up with both what draft regulation language could potentially look like. We'll work with council on that, as well as maybe a mock-up or two of what the design could potentially look like.
So I'm looking at attachment 2. Does the poster start with the notice to consumers?
Yes.
Okay, and it's just a plain text like that. Got it. Thank you.
Okay. And do we need a motion for this, or could we just send it back to staff?
I think that staff have direction.
Okay.
You'll definitely need to when we get to the rulemaking portion, but I think for now, I think we have direction. Thank you.
Okay, so we don't have to do a motion then. Okay, any more comments from board members? Our board members? Okay, hearing none, thank you. We'll now move on to item D. This would be the discussion and consideration of requiring pharmacies to provide a telephone number on prescription labels. Background on it, at the November 2019 board meeting, the board adopted language to amend CCR section 1707.2 related to mail order pharmacy consultation. The regulation requires mail order pharmacies to provide a phone number for patients to receive consultation from a pharmacist. During the board's discussion, it was noted that out-of-state pharmacies must provide a toll-free number to facilitate communication between patients and pharmacists, and the number must be provided on the prescription label. However, there is no requirement for the in-state pharmacies to provide any phone number on labels. The board directed the Communication and Public Education Committee to discuss and consider whether all pharmacies should be required to provide a phone number on prescription labels. For discussion and consideration, Business and Professions Code Section 4076 and CCR Section 1707.5 provide requirements for patient-centered labels on prescription dispensed to patients in California. Neither section requires pharmacies to provide a phone number on the prescription label. Copies of the BPC Section 4076 and CCR Section 1707.5 are on your attachment 3. For comparison, staff research prescription label requirements in 2 neighboring states and 2 large states. A brief review of online sources indicates, well, I'm going to have Bob go into that so he can give us an overview of it, because again, he's a public information officer and he's part of a research here. So Bob, if you can elaborate on that.
Absolutely. I checked online sources for regulations and laws in a couple of neighboring states, Arizona and Nevada. Neither of them require dispensers to provide a phone number on the prescription label, although Arizona does require mail order pharmacies to provide a toll-free number on the label affixed to each dispense container. I also checked with 2 large states similar to California, New York and Texas, and both of those states do require prescription labels to contain a pharmacy phone number. I would note that BPC Section 4076 and CCR Section 1707.5, which are included in your attachment materials, already require a lot of information to be printed on the prescription labels currently in California. They require the following items: the patient's name, the drug name and strength, directions for use of the drug, the condition or purpose of the drug if the condition or purpose is indicated on the prescription, the prescriber's name, the date of issue, the pharmacy name and address and prescription number, the drug quantity, and the drug expiration date. So should the committee and the board agree from a policy perspective that incorporating a phone number is important, Such a change would most likely need to be done either through a statutory or regulation change. In addition, there could be a cost in requiring pharmacies to provide phone numbers on these labels. We would welcome any committee discussion and direction on this matter.
Okay, thank you. Any board member comments? Okay, hearing none. Moderator will not open lines for the public comments.
This is the moderator. We've opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Our first comment comes from Stephen Gray. Stephen, your line is open. You will have 2 minutes.
Thank you. This is a very important topic that has come up several times, and I'm not sure everyone is aware of what really happens out there. Most pharmacy labels have a phone number on it, but it isn't necessarily the phone number of the pharmacy. It may be the phone number of an answering service. It may be the phone number of a call center. And this is very difficult for patients and even other healthcare providers when they need to get a hold of the pharmacy from which the person got the prescription. And this is even more important now when we have so many more deliveries. And some pharmacies don't consider deliveries as mail order, but so many deliveries and so many curbside pickups, and so many times when someone else other than the patient is picking up the medication. And the patient or a patient's caregiver, when it gets to the patient, has a question and they want to talk to the pharmacy that dispensed the medication, it's almost impossible to do. And in fact, many of the pharmacies in California, not necessarily the independent pharmacies, but many of the pharmacies in California don't even have a phone number of the pharmacy on their websites or listed in any kind of directory. Again, you get directed to an answering service or a call center, and it's almost impossible to get through to the actual pharmacy. So I think this is really important, and I think it's important for the consumers to be able to talk to the pharmacist that would have given them the consultation if they had been there, and knows exactly what the situation is more likely with the prescribers. Often these pharmacies are in a medical building or nearby, and the call centers, which may be across the state, are not. So I think this is an important change, and it's interesting that it's required of out of state but not in state for it to be toll free. Because as I mentioned, some of these call centers are at the far ends of the state in which the patient is trying to get a hold of. Thank you very much.
Thank you.
Seeing no additional requests, I will close the Q&A panel.
Thank you.
It is closed.
Go back to the board.
Hi, this is Jason. So by including the phone number on here, are we requiring that, what would be the difference, I don't know if Ann has the answer, if between what we have now, wherein it could be a call center, are we requiring that the phone actually is connected to the on-site pharmacy? Is that what we're considering?
Hi, Jason. I may ask Eileen to jump in as well. I do not believe that there's a requirement for the phone number to be on there. I think that some pharmacies may, but I'm worried that I'm misspeaking and I'm questioning myself. So I think part of it would depend on if you want to require that the pharmacy put a phone number on the label and that it be the number to the pharmacy itself. I do think that that would require change in the law.
And I would agree with that, Ann, too. And if the committee decided that's the route it wanted to go as we pursued any, be it statutory or reg change, we could also specify that it's got to be to the pharmacy where somebody could consult with the pharmacist if that's what the committee wanted to do.
Okay, so it's up to our committee to decide whether we want to make the bring that up to the full board whether we want to do, the changes, which is going to require statutory change also. So,
Yeah, under the
any more comments from the board members?
Ricardo, I would just say that right now the law requires that it be the name and the address of the pharmacy.
Yeah, but we want to, what's being brought for us is the actual phone number of the actual pharmacy giving the prescription. Whether we want that on the prescription itself, right? I mean, that's what we're looking for, whether we want to recommend that or bring it up before the full board. And I'm trying to get just a little bit more feedback from our board members, if that's the direction they'd like to go with.
Well, I think it's important for consumers to have a phone number, but I don't know if I'm ready to say that it has to be a staff phone number to a direct pharmacy where you can get 24-hour consultation. I don't think I want to go that far, but there does seem to be an issue of having a call center not being satisfactory, or is that okay right now?
Yeah, what's the alternative? Any suggestions, Anne?
The label itself is one communication tool, but I think that that's not the only communication tool. And I do think that there have been, requirements in the past where, there was ancillary information that was provided. So there's pros and cons to that approach, right? If it's a supplemental piece of paper, then the consumer could potentially throw it away, but they would still have access to the information. I think that some would say that when it's not on the prescription label itself, then a caregiver may not have access to that supplemental information. It's a balancing act, because if we put too much information on the label, then it's just a little hard for people to really identify. It might almost be worth us exploring. I'm able to find the phone number for my pharmacy, doing a little Google. So maybe before we, go to fully mandating this, maybe we reach out to some different stakeholders, consumer groups, and find out if their stakeholders are actually having a hard time identifying the pharmacy number when they need it.
Okay, so basically we're recommending we do a little bit more research with our stakeholders, whether it's even an issue, whether it's the consumers actually having issues with it, right? Then having staff come back with whatever they find.
I think that's one possible outcome for the committee.
That's board members. Any more comments or input?
This is Jason. I would support that.
Okay, so
Does somebody want to make a motion to that effect, or
do we need a motion since we're sending it back just for a follow-up?
all right? So the consideration,
Yeah.
just making sure that the whole committee is in agreement with that.
Okay, so Anne, do we need to do a motion? Send it back?
I think that committee members can just state that they agree, asking us. I don't know that we need a motion, because you're just asking staff to do something.
Yeah,
Exactly.
I was going to say it was like the previous.
Or the committee agrees.
Yeah.
Yeah,
Okay.
I agree. It's Ryan Brooks.
And then Shirley, how do you feel about it?
I agree as well.
Okay, and I agree with it also. And I know Jason just stated he agrees with it also. So we'll send it back to the staff, and they could research and check with some of the stakeholders to see if it's even an issue with our consumers having difficulties in reaching or getting a hold of their pharmacists. And if possible, give us some findings at our next meeting that we have. Is that enough, Anne?
Sorry, hard time finding the mute. Yeah, that
Okay.
works great for me. Thank you.
Okay. Okay. Well then, well, thank you, and let's move on to item E now. Discussion and consideration of developing information materials about the Board of Pharmacy for consumers. The board provides the public with important information about patient care, consumer protection, and regulatory issues through a variety of print and electronic materials. These materials include brochures about counterfeit prescription drugs, an online directory of drug take-back locations, and web pages with links to drug abuse prevention resources. Staff is proposing to develop additional educational material about the mission and work of the Board of Pharmacy. As an example, the materials would provide basic information about the board's membership, number of members, licensees, and public members, board committees, how to participate in the meetings, etc. Other information could explain the rulemaking process, how complaints are investigated, the disciplinary process, and other ways that the board performs its consumer protection functions. In addition, educational materials could explain why consumers should talk to their pharmacists and what consumers should ask about their medications. Information would be posted on the board's website and also available to download and print and distribute. Hard copies would be available to disseminate to the public at board meetings, training events, and public outreach activities. These materials would increase general awareness of the board and educate the public about the board's role as a consumer protection agency. Staff welcomes suggestions regarding topics that should be included in information materials about the board. Any board member comments?
Yeah, Chairperson Sanchez, if staff could provide us with information that's currently provided to the public, what kind of outreach does currently go on, and what has happened in the past would be helpful, just a baseline of where we're at.
Okay. Hey, Bob, do you want to elaborate on any of that?
Sure. We do currently have on our website some brochures that sort of is the core of our consumer outreach. These are brochures on topics like buying drugs online, things to be aware of, questions to ask your pharmacist when you get your prescription picked up, and some other topics. One of the issues we have is that we have only in the recent years developed a way to reach out to consumers more directly, mostly through a listserv that a news listserv that reaches the public, and also social media. So that's become another avenue for distributing some of the current information we have. But what we don't really have a lot of yet, and what we're suggesting in this item, is materials that sort of explain to the board, to the public, some of the basics about the Board of Pharmacy, who we are, what we do, what we're here to serve, how we're here to serve the public, and what we can do. And those are the kinds of things we'd like to focus on, in addition to specific consumer information about getting your how to take your medications properly, and what to ask a pharmacist about. We want to let the public be more aware and mindful of the board and its role, and the fact that we're available to them to help them as a consumer advocacy group.
And all this information would be posted on the board's website, which is anybody can look at, and it's updating and giving more information as to what our role is also. Any more comments from board members? Okay. Hearing none, can we open this up to the public? Any public comment?
This is the moderator. We've opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on the screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. We will now pause for a brief moment. Seeing no requests, would you like me to close the Q&A panel?
Yes, please.
It is closed.
Thank you. Okay. So basically, these are suggestions from staff to update our board website. I think there's some good ideas as far as what our mission are and what we provide here at the Board of Pharmacy. Is there any more discussion from board members or any more comments? Okay, I agree that it would be important for staff to update the information that we've gone over here regarding our missions and what we provide to the public, and if they could put something together and come back to this committee and give us an update, that would greatly be appreciated. Is there anything else that we could add to it, Anne?
The only thing that, Ricardo, I'm wondering if there's an opportunity, and I'm clearly not the IT person, it almost seems like if we are updating the notice to consumers and there's some way to leverage the consumer poster itself to have some sort of, I don't know, barcode or something that then someone could zap, on their phone, and then it would take them to the board's website specifically to some of the consumer materials. I think that would do a couple of things. One, it might free up some more real estate on the notice to consumers poster, but still provide an easy way for consumers to identify us.
Kind of like the restaurants where you just get the menu off of the wall there. Right.
Well, so I am not the IT person, but it's like there's got to be a way, right?
Yeah, I don't know what it might be, but any suggestions or anything that they could update us on would be great. So.
And then possibly maybe discussing a priority. There were a lot of information talking about that, so if that was the committee's suggestion, maybe have the staff concentrate first on the information going to the consumers, maybe with respect to their rights, or maybe set some priorities for the staff in tackling this?
Yeah, we like Bob Donnelly just went over some of them, and like our board membership, number of members, licensees, public information, that sort of stuff. If they could update our website, because that's what we're talking about, and or give us a sampling of what it might look like so that our committee could look at it and also chime in on it would be nice. And by the way, any board member, feel free to chime in on this. Okay, hearing none, then if we could have the staff bring us back something that would include their recommendations here, would be nice at our next committee meeting. Ann, do you think that would be enough here? Or do you want to add anything to it?
No, we'll take what you've told us, and then we'll try to, provide some additional information at the next meeting, and you can let us know if we're hitting the mark.
Okay, because you guys do. I like the board's website. We put plenty of great information. And stuff that you guys have suggested in the past has been really helpful with assisting people with addiction and so forth. We have different avenues, different paths that people consumers can take when they go to our website to get help or to find out where to dispense their old medication and so forth. You guys have done a fabulous job with that, and you guys just keep coming up with good ideas, and it's nice when you bring it back to us and we could actually see it. So, I like that idea. So if you could direct staff to do that and bring back something that would better our board website, especially the suggestions that we just went over. Great. I don't think we need a motion for this either, right, Ann?
No. We
Okay.
don't.
Yeah, I don't think so.
It's just information regarding our website. Okay, great. Well then, thank you, and let's move on to item F. Okay.
Actually, before we move on, I wanted to check because you're going on to the update on communication and public education activities, correct?
Yeah, by
Before we
staff.
move on to updates, I wanted to check to see if we were going to cover the minute approval from the last meeting, because that's another thing that will require committee action.
Oh, I thought I must have missed that. Okay. Well, then we will have to go over the minutes. Well, has everybody, board members, have you all had an opportunity to look at the minutes of our last meeting that we had?
Motion to approve.
Okay.
I'll second.
Okay. Okay, so Ryan made the motion, Jason second. All those in, oh, I guess we can't do it that way because it's vocal. Hold on.
Ricardo,
I'm just gonna go.
I'm sorry. Ricardo, I apologize.
Yeah.
I do think you do need to provide an opportunity for public comment.
Okay, okay. Can we open this up for public comment then?
This is the moderator. We've opened the Q&A panel. To make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. We'll pause for just a moment. Seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
Okay, back to the committee. Okay, we have a motion by Ryan Brooks and a second by Jason Weiss. As I call your name, please indicate yes or no on your vote. Ryan Brooks,
Yes.
Shirley Kim,
Yes.
Jason Weiss,
Yes.
and Ricardo Sanchez, yes. So it's unanimous here. It passes. Thank you. And now we will move on to item F, which is our update on communication and public education activity by staff. Now, this will cover the script, the board-provided training, staff outreach, and news media. The outreach and the news media is on your attachment 4. It's provided for you. I will have Bob Davila, our public information officer, go over these items. Go ahead, Bob.
Thank you. I'll just go over all 4 of them real quickly, and then the committee members can ask any questions or provide any comments. One, the script. We have articles planned for the next newsletter that include new pharmacy laws for 2021, a reminder about new security prescription form requirements and cures reporting requirements, and tips for completing a pharmacy technician application. The articles have been submitted for legal review, and we expect publication most likely in February. On item number 2, board-provided training, inspectors and staff provided CE training via WebEx on prescription drug abuse and diversion, what a pharmacist needs to know, on October 7th and December 16th. A total of about 150 pharmacists participated in the 2 events. Item number 3, staff outreach. A list of staff outreach activities between October 1st and December 31st, 2020 is in attachment 4. And finally, news media inquiries. The staff responded to news media inquiries that are listed in attachment 5 during the same period. Thank you.
Okay, thank you. Any board member comment on any of these items? Okay, hearing none. Can we open this up to public comments?
We have opened the Q&A panel for public comment. If you'd like to make a comment, please click on the Q&A icon on the screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. We'll now pause for a brief moment.
Okay.
Seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
Okay. Thank you. Let's move on to item G, which is future meeting dates. Scheduled committee meetings in 2021 are April 29th, July 14th, and October 27th. Any board member comments or public comments? I'm sorry, any board member comments first?
Only, I have to hop off right now.
Okay.
Another meeting just started about a minute ago. Thank you very much.
Thank you for participating and helping out, Ryan. Appreciate your input and your advice on the billboard stuff.
Likewise, thanks.
Okay, comment?
This is the moderator. We have opened the Q&A panel. Again, if you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. We will allow just a moment. Seeing no requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Since there's no comments from the public, this meeting will be adjourned. Thank you for your participation, and we're adjourned.
Thank you. Bye, everybody.
Bye. Thank you for participating. Bye, Shirley.
Bye.
Bye, Ryan. Okay. And thank you, everyone.